Welcome to Academic Matters. I'm Brian Goldstein, Provost and Vice President of Academic Affairs at LaSalle University in Philadelphia. On our show today is Dr. Meghan Pierce in the Department of Marketing in the LaSalle School of Business. Welcome, Meghan.
Thanks for having me.
Thank you for being here. So let's begin by talking about where you grew up, where you were born and raised, where you went to college, and how you ended up at LaSalle.
Okay. Well, I was born in Norfolk, Virginia, Virginia Beach. My father was in the Marine Corps, so we moved around a little bit. So quickly after I was born, we were whisked off to Kailua in Oahu, Hawaii for 3 years. And after that, we moved, my father was working at the Pentagon, so we moved to Fairfax, Virginia, which is just outside of Washington, D.C. I went to school at Virginia Tech. I studied marketing and foreign languages and literatures with a concentration in Spanish. And during and after my time there, my first job was at the Fairfax County Park Foundation, which is kind of the nonprofit arm of the Park Authority. And during my time there, I got to work on a lot of really neat projects, one of which was Clemmy-Jontry Park. That park was donated by a woman named Adele Lebwitz. She donated her 18-acre estate in McLean, which is prime real estate territory, to the Park Authority. And they ended up developing that park as a playground for children with all abilities. So children with developmental issues or sensory issues, children who are in wheelchairs or who work with braces and walkers, they could enjoy the same playground experience as able-bodied children. So that experience really excited me about the nonprofit world, and my first study abroad experience was to Quito, Ecuador. And so with the Park Foundation and my travels to Quito, I started to become aware of the inequalities in the world and be exposed to some more social justice issues. And that really started to lead me down the path that I am in today. During my time at Virginia Tech and at the Park Foundation, I quickly found out that marketing was not just about selling products or services, and that marketing could be applied to for-profit businesses, but also to not-for-profit businesses or government agencies, and that we can use marketing tactics to change people's behaviors or get them to believe in certain ideas.
So how do you incorporate that into the classes that you teach? So maybe start by talking about the classes that you've tended to teach, and then how you integrate your love of marketing, your background in languages and literatures, and particularly Spanish. I know you speak Spanish, and then maybe move into the research that you do.
Yeah, so I typically teach marketing research, which is kind of the process of going through problem diagnosis in a business to problem definition, figuring out how to collect qualitative or quantitative data, analyzing that data, and then coming up with strategic marketing recommendations from that data. And in my classes, I try to bring in that social marketing side by having students focus on social issues in the local community. This semester, I'm working with a local nonprofit called Face to Face. It's in Germantown. And actually on Tuesday, we had Mary Kay Meeks from Face to Face in Germantown come to class. She presented the organization to the class and told everybody about their clients and their mission and vision and some of the challenges that they're facing today. One thing that they want to know is, who are their clients, how are they serving them well, and what can they do better? And so through the course of the next 15 weeks, my class is going to tackle those issues through applying the marketing research process, collecting secondary data that's already been collected for other purposes and by other organizations. Then they're going to move into a qualitative data phase where they're going to sit down with face-to-face clients, have a conversation with them about their lives and their needs, and how face-to-face is related to that area of their life. And then they're going to move into a quantitative data collection phase where they're going to do a large-scale structured survey, analyze that data, and then come up with strategic recommendations for the nonprofit. So that's one way that I try to bring in that social marketing side into the classroom, but it's usually much more statistical and practical, but we can kind of have the best of both worlds by showing that marketing is more than just about products and services.
So is that how you see marketing perhaps being misconceived out in the public, in terms of it's not just about selling some product? And so how do you build that into the classes that you teach to help students understand that?
Yeah, marketing is often viewed as selling, advertising, and it is that, but it's also much more than that. We can use marketing tactics to get people to switch from one product to another. We can get people to use marketing tactics to switch from one service provider to another. But we can also use those same tactics to understand why people behave the way that they do, and what things might make them switch their behavior to maybe a more socially good behavior that can benefit the local community.
So I know that you're working on a paper about how risk and language proficiency influence the use of services in marketing. Can you talk about that work and how you've been able to, again, keep incorporating your love of language into the work you're doing in marketing?
So after my time at Virginia Tech, I got kind of tricked into continuing my education for a PhD. And after I completed my PhD, I got a job at the Catholic University of Chile in Santiago. And during my time there, I realized that there are a lot of people who are living in other countries than the one that they were born in, or the one that their parents or family come from. And so it's kind of a big market space. And you can imagine when you're trying to learn a language, or when you think you're proficient in a language, that there are certain situations where you might want to practice that language, and there might be other situations where you might not. So we hypothesized that in low-risk situations, that you would be either indifferent or prefer even speaking your second language when you're bilingual. But in high-risk situations, that you would be more tending to the side of wanting to use your native or first language. So for example, imagine you're in a restaurant, you're very excited about practicing your new language skills, and you start to order off the menu and you feel like you pronounced everything perfectly, and all of a sudden the server recognizes that you're not from that country and they start to speak to you in English or whatever your native language is. That can be really frustrating. You think, oh, I thought I was good at speaking this language, but there are cues that are telling me that maybe I'm not so good. And so in that situation, we find that consumers really would rather be spoken to in the native language of the country. But on the other hand, when they're faced with high-risk situations, like let's imagine we're in the doctor's office. And in a doctor's office, it can be an anxiety-ridden experience. You might be worried about some illness or injury. And in that case, you might want to have a conversation in your native language to make sure you've understood all of the directions from the doctor.
That's a very interesting example, because I think there's a misperception that if someone is not speaking the more majority language, it's, oh, they know that language and they're just averse to speaking it, as opposed to there being a situational influence that determines which language they're going to speak in a given situation.
Absolutely. And another way that I incorporate this kind of language use in my time at Chile into the classroom is that next semester, Professor Carolyn Plump, who's in the Management and Leadership Department, and we're going to be running a travel study to Chile. So we're hoping to bring students down to Latin America, start to engage with Latin American businesses. And the focus of the course is going to be on social innovation, social entrepreneurship, and social change, which is directly related to some of the work that I do now. Chile is a hub for entrepreneurship and benefit corporations, or B Corps. 5% of the world's B Corps are in Chile, so it's kind of an exciting place to study all this social entrepreneurship that's going on in the country. And social entrepreneurship is really just for-profit businesses that have a social mission in mind.
So perhaps you're still determining what you're going to do when you're down there, but can you give some examples of perhaps the places that you'll go, or the assignments that you're going to have students do, so that, again, they can incorporate this from a practical standpoint?
Absolutely. We are still working out some of those details. One of the social enterprises that we're talking with now is called Al Gramo. And Al Gramo means by the gram. And in a lot of impoverished communities, there's low access to commodity goods. Impoverished people often have trouble purchasing products and end up buying the small package sizes that cost a lot more money than the big package sizes in terms of unit prices, right? And so they often will forego different food items or different health products just because they're way too expensive. And so this particular social enterprise is buying things in bulk And then they're selling it by the gram, al gramo, to people in impoverished communities so that they can have access to these goods at a more affordable rate.
And so what are you expecting then for students to come out of the travel study with?
Yeah, I'm expecting them to understand that there are many business models in the world. Some of those are for-profit. Some of those are for-profit with a social mission in mind and thinking about the local community. And sometimes those kind of businesses can be even more profitable than a business that doesn't consider the community, because it has multiple ripple effects, right? Not only do you find people wanting to go to the business because they feel good about those purchases, but on top of that, they start to think, well, maybe this is the kind of thing that I want to do myself as well. Yeah.
So you've been here 3 years?
This is my third year.
You're starting your third year. Tell me what you particularly enjoy about teaching at LaSalle and about the students that you've been fortunate enough to teach in your slightly over 2 years here.
So I've taught in many different places. At Virginia Tech, I taught classes of 82 students. In Guatemala, like 45, and Chile, 60. I taught in Switzerland. Those were smaller class sizes too, 40-ish. But here I get to teach in a classroom of 25, and that allows me to engage with students a lot more than I was able to at my previous institutions. And the other thing about LaSalle students is that they're ready and excited to engage. They know that they're not just another seat in the classroom, not just another body filling the room. They know that there are so many opportunities here on campus, like travel study, like undergraduate research, the Business Scholars Co-op program, things of that nature that they can become involved with, and faculty are ready and willing to welcome them into their offices. That's
great. So if students are watching and they're interested in the travel study, should they contact you?
Oh, absolutely.
Directly?
I live in 330 in the new bright, shiny business building, and my email is Pierce, P-I-E-R-C-E-M, @lasalle.edu, and I welcome any and all inquiries about that travel study.
Well, on that note, I would like to thank you for being on Academic Matters, and good luck the rest of the semester.
Thank you.
Thank you.
It's learning how to code or make video games and websites.
Not only can you post videos online, you can make your own.
It's learning about leadership.
Together we are Tech Girls.
You are now watching LaSalle TV.
Welcome to Academic Matters. I am Brian Goldstein, Provost and Vice President for Academic Affairs at LaSalle University in Philadelphia. And I'm pleased to welcome Dr. Daniel Rodriguez, Associate Professor in the Department of Urban Public Health and Nutrition here at LaSalle.
Thank you very much for
Welcome,
having
Daniel.
me.
Glad that you're here. Let's start by your giving us a little bit of information on your background and how you ended up at LaSalle.
So it's a very long history. From Washington, D.C., I always was interested in, teaching from when I was young, and I had some good role models who, like one of my uncles was a professor of history. He kind of stood out as something, giving me an opportunity to do something a little bit different. How I got here was very complicated. I studied my undergraduate. I started it at Maryland, but I didn't finish it there. I ended up finishing at San Diego State. I wanted to get away from, I wanted to get away from the family, be as far as possible I could from home. I'm from DC, so going to San Diego was actually clear across the country. I ended up coming back because I wanted to be back with my family again, and I did my doctorate at the University of Maryland. And then after that, I needed a job. So I started looking for jobs. I wanted to teach right away. And it's actually hard sometimes getting a teaching job right after you finish your doctorate. Many times students get postdoctoral fellowships. I went straight to teaching. I started by teaching at Widener University. And I kind of felt like, well, it was great, but I was teaching a lot, so I wanted to get some experience doing research. So I went to the opposite direction and started doing research. I came out of a very research-intensive program at the University of Maryland, so I went to Penn, and I actually did a reverse. I became a postdoctoral fellow after teaching. I stayed at Penn for a year as a postdoctoral fellow, and then became a faculty member there on their research track and stayed there for about 10 years. When I was there, I started looking for teaching again because I started going in the opposite direction where I was doing too much research. And John Rooney, who was here at the time, one of your esteemed professors in psychology, invited me to teach a course in development. So I started teaching here actually as an adjunct in 2002. Teaching about one course a year, then went to like 2 courses a year, then 3 courses a year, and it started going on, and it was just the most wonderful experience I could have. I fell in love with LaSalle, and when I finally got the opportunity to become a full-time faculty member, I said this during my interview, I feel like I'm at home, and that's what makes me happy to be here.
Thank you. Public health is often not a field that a lot of the public knows a lot about, so maybe take 30 seconds, tell us kind of what public health is and how you ended up in public health.
Well, we look at population rather than individuals. In medicine, doctors and nurses, nurse practitioners, people focus on the individual, on the patient, and they try to help the patient get cured from a disease. We actually focus on population level factors, and our main issue is in prevention. Disease prevention through primary prevention, where we, for instance, vaccinate, or we teach people how to eat correctly, to exercise, to not smoke. And sometimes we deal with people who are already sick. We teach them how to not get worse. We do something called secondary and tertiary prevention, where we try to prevent individuals who are already within the disease process or even have been stricken fully with the disease to not get worse and to survive and to manage. How did I get into public health? Well, I'm a statistician, so everybody needs a statistician. When I moved from Widener to Penn, when I was at Widener, I fell in love with teaching health psychology. So it was a unique and very intriguing course. When I went to Penn, I had already published some work using some more advanced statistical methods called structural equation modeling. That's my specialization. And the person I work with at Penn, Dr. Janet Audrain McGovern, I became her fellow. And she needed that kind of data analysis. So her area of study is tobacco use and physical activity, and how physical activity can be used to prevent adolescents from becoming smokers. So we were a perfect fit. She needed somebody who did latent growth curve modeling. That's the kind of modeling that I do. I know this might be foreign for a lot of people, but it was something that I do really well, and she needed that. And I was also doing research in physical activity. So, and I had that interest in health psychology, and all of a sudden, we were a perfect fit. So I started publishing a lot in public health research. So that kind of moved my career path away from psychology towards public health.
So talk more about that work then that you've done specifically around smoking cessation and factors such as gender, geography, sleep, socioeconomic status, and how those factors seem to be working relative to smoking and smoking cessation.
Well, smoking cessation is a very, very difficult topic. The problem is we can't get people to quit. It's hard. I mean, no matter what research we do, it seems like in the end people just choose to quit and then they just stop cold turkey. So that seems to be what's working best. I think the best way to not smoke is to prevent people from smoking in the first place. Some people are genetically predisposed to smoke. Some individuals have a deficit in their ability to experience reward, and nicotine is a way to easily experience reward, and particularly when one inhales nicotine through smoking, and we call them combustible cigarettes now because there's electronic cigarettes, but one inhales that smoke, it's a quicker pathway into one's chemistry, brain chemistry, and one is more able to become addicted and feel the rewards associated with nicotine. So in a sense that it's a pre-packaged reward. So what we'd like to be able to do is actually prevent people from experiencing nicotine in the first place, because there are people who are predisposed to it. And what I'd like to be able to do, and what my work has done, and the work with Dr. Audrey McGovern and many other people with whom I collaborate, was actually focusing on how to incorporate extracurricular activities that are equally rewarding to get people to feel the reward from, say, like I play tennis a lot. And when I play tennis, if I hit a good shot, I feel rewarded. And that reward that I experience is the same reward somebody experiences when one inhales a cigarette and gets that nicotine. The same brain circuits, the dopamine circuits, your reward centers of your brain are being rewarded, and you feel good. So what we're trying to do is teach people how to be rewarded using some action of their own, like a physical activity, perhaps, I don't know, learn how to juggle, learn how to write, become an expert in movies, whatever, but doing something different than smoking. So essentially, while it's very, very hard to get people to quit, and that was your original question you asked me, it's actually easier to get people not to start. So that's what I like to focus on.
So are there other outcomes, reliable and valid outcomes, other than reward, that will likely keep people from starting to smoke in the first place?
That's a tough one. Well, certainly policy. Policy actually works pretty well. Raising the prices of cigarettes has reduced a lot of smoking, yet people still buy cigarettes, and it's very disheartening to see. I go to my local Wawa every morning and I always see people buying cigarettes. And some of the people who buy cigarettes cannot afford it. And I know if someone is addicted, truly addicted to nicotine, they're foregoing a good meal in order to buy cigarettes that cost $5, $6, who knows how much a pack, $7 a pack. And it's very disheartening. Policy works, maybe also limiting access to cigarettes. We see that there are a great deal of cigarette outlets, particularly in areas where the poor live. And unfortunately, the poor are the individuals who smoke the most. So these areas are saturated with tobacco outlets. So we're not really sure what that does yet, but it certainly provides access. I mean, does it actually cause people to start smoking or prevent them from quitting? Well, certainly there is more access and people may be smoking because of the greater access. So I think policy would help eliminating the density of tobacco outlets in a certain community, keep on raising the prices, and eventually ideal would be to not sell tobacco at all.
So another public health issue is obesity. And I know recently it seems that body mass index, or BMI, has not been found to be an important predictor about health and weight. So can you talk about what's changed and perhaps what we should be focusing on more relative to body weight and obesity?
Well, certainly health. It doesn't matter what one's shape or size is, as long as one is healthy. So we want to look at cholesterol values, we want to look at percentage of body fat, percentage of lean body mass. These are things that BMI doesn't capture at the individual level. I will counter your point by saying that as a statistician, I think BMI is a great measure, but at population levels, not for the individual. I would urge people not to focus on BMI for themselves, but in terms of research, it tends to be a good measure. The problem that we have with conducting studies is that it's not very easy for us to have access to data on, say, cholesterol or even percentage of body fat. I worked in a study where we had to collect these measures, and it's actually very invasive, very painful. You have to pinch somebody, or maybe these days you can do more, you can use other kinds of technology to get this information. But it's not as convenient as BMI. To get BMI, all we need is your height and your weight. So I think at a global level, it's a good measure, but it's not the ideal measure when we're dealing with individuals, and I urge people not to focus on that, because it has when people focus on weight, it generally doesn't turn out to be good. We get misperceptions of what we are.
So how do you take current public health issues like smoking, factors related to smoking, obesity, and incorporate those into the classes that you teach?
I do it all the time. It's probably too much for my students. They know that I study smoking. I think all my students are experts in smoking now, but I've published a lot of studies, so I teach research methods, and in research methods I teach my students how to publish articles. So I go to my articles right away. I teach grant writing. I have my students read articles that I've done, read articles that my colleagues have done. So I'm constantly bringing that in. And there's a lot of these public health issues that have relevance to people, like whether it's obesity, texting and driving, drinking and driving, or just drinking on campus, binge drinking. So we talk about these all the time. And students get excited when they hear about real life situations. They prefer that over equations, although I like doing the equations as well. So.
Great. Well, Daniel Rodriguez, thank you very much for joining us. We greatly appreciate it.
Thank you very much.